If you are interested in thinking about boundaries in a deeper way, a way that can actually work in your brain, life, and within your authenticity, then check out the new book, Setting Boundaries That Stick by Julianne Taylor Shore, LMFT, available wherever books are sold. Welcome, Season Sixers. As always, thank you for being part of our Color of Success podcast family. I'm your favorite host, Dr. Stephanie J. Wong. Keep your eyes peeled for my brand new book coming out. It's called Cancel the Filter, where I share my experiences in the realm of mental health, both professionally and personally. Subscribe to colorsuccesspodcast.com to be on our waiting list. Seats are limited and being filled as we speak. We're also streaming on all your favorite platforms and socials. Whether you're on the go or comfy on the couch, you can tune in at your own comfort. As you know, we love growing discussions with our guests from our AAPI and minority communities. With so many friends and experts from different aspects of life, we love learning their stories and understanding what their success means to them. Let's get into it. A Yale-educated nurse and digital health executive, Pritma Dhillon Chattah has dedicated herself to improving lives through innovation in healthcare. Her most recent venture, Lavender, is the first online psychiatry office founded by nurses. Her team of 95 plus have served 6,000 clients since May 2020. Pritma is also a fierce advocate for BIPOC nurses and their ambitious endeavors in transforming healthcare. Pritma, thank you so much for joining me today. It's been a long time coming, and I'm really excited to have a deeper dive into the topic of ambivalence and stigma around seeking mental health.
Thank you so much for having me. I'm excited to be here.
Well, you are the co-founder of Lavender, one of our generous sponsors on other episodes. It's an online psychiatry and therapy office. And I know you've done tons of interviews. You've gotten a lot of awards. Congratulations.
Thank you.
And I wanted to actually take it a different way, especially what have you observed in the communities that you work with? And, you're in tech. You identify as an ethnic minority and from an underrepresented group. So wanted to get your thoughts on that topic.
Definitely. As a South Asian woman of color, myself and a daughter of immigrants, it's been really encouraging to see diverse experiences of ethnic communities included in recent conversations about mental health. However, there's still a long ways to go, and there's still so much stigma around sharing one's feelings. And I really feel it stems from the elder generation in our community who are really ambivalent about mental health as they consider the symptoms to be negative and really they feel that they're signs of weakness and vulnerability, and they've just been born and brought up that way. But we're really seeing a shift, however, in this generation. So I'm really glad to see that. And I actually think that the pandemic has contributed significantly to reducing stigma around mental health, particularly around South Asian communities. I've seen it at Lavender. I've seen it in our practice. We're definitely seeing more ethnic minorities reach out for help and be more open about their symptoms. But I'm also seeing it personally. I'm seeing it in my circles. I'm seeing it in my family. It's become normal dinner conversation, surprisingly. And I've even seen it discussed among men, which I think have the furthest way to go in terms of sharing how they're feeling and seeking help and support for when they are feeling big emotions.
And I think that for your and my generation, that we can be agents of change. We can talk with our kids about mental health. We can also bridge the gap with the older generation as well. And again, one thing that I want to be very clear on is that we are not saying all Southeast Asians are all AAPI folks. So from your experience, though, what do you think contributes to that ambivalence and stigma that has existed for many, many years, especially in immigrant populations?
Well, I think, like I said before, it really stems from our elders. And I personally wasn't raised to talk about my feelings and talk about my emotions. Again, it was a sign of weakness. So we never talked about the hard things. We always talked about the wins and celebrated those, but we were very shy and awkward about talking about our feelings. And we've come a long way. And I think our generation definitely are those change agents. However, you know, I have kids, I have a 3 and a 6-year-old, and I'm helping them understand their emotions and name their emotions and their feelings, but also developing some mental toughness is important in the next generation as well. So trying to balance it. We don't want to move the needle all the way to the opposite side either.
Let's talk about medication though, because that is part of the Lavender platform, is to increase access. And I think sometimes there's a difference I've noticed in my practice of people are okay with talking about their feelings in the practice. And then when you suggest maybe psychiatry or talking about taking medication, they're like, oh, no, 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 no. So what do you think about kind of this stigma that we're also facing with medication management or even taking it?
Goodness, medication is a whole other topic and a whole other stigma. And ethnic communities have only just begun to normalize talking about their feelings. We have a long ways to go to destigmatize medication. But the stigma surrounding mental health medication spans all communities. It's not unique to one culture. And that's what I've noticed. That's certainly what I've noticed at Lavender with my peers and with our patients, is that it spans all cultures and it's not unique to the South Asian community or ethnic minorities. I think we're all equally ambivalent to taking mental health medications.
Sure.
And I really think the first step to moving the needle on that is getting professional state regulatory boards to the table to actually change some of the antiquated practices. For example, physicians, nurses, psychologists, we all need to attest to being mentally sound and capable of performing our jobs. And we have to report whether we're taking medications. That medications, particularly for our mental health. And I think that can be revisited. And we really need to be more open to understanding that it is okay to take medication, not only for professionals, but for any profession. And there's a lot of regulated professions, but it begins there. And that's a huge segment of the population. And by doing that, it allows professionals to speak more openly about their own experiences with mental health, about their own medications that they take. And I think beyond that too is really normalizing it within the workplace, within all workplaces. Medications augment human performance. And so my background is in digital health technology. That's always been my space. Although I'm a nurse, I'm not a practicing clinician. I've been focused on enabling healthcare through technology. And when I think about medications, I use the metaphor, or I try to understand or rationalize it in that in health tech, we use AI, for example, to augment human performance and to improve outcomes. And so why can't we use medication in a similar fashion? Why don't we observe it as an augmentation for our systems or our symptoms so we can more effectively contribute as humans and add value to our communities, right?
I think
we use so many tools to augment our work and our performance as humans.
And in our professional spaces too, there are slaps on the wrist or perceptions that even among colleagues and providers and so forth, that if we are disclosing our health information, that people are going to deem us as unfit and unable to perform our jobs. And I really think that mental health providers, physicians, all that, we're experiencing high rates of burnout. And so the shift is really, how do we normalize that mental health providers are people too? And that just because you are seeking your own help doesn't mean that you aren't able to perform at your job. That's a whole revamping of the system and of the way we are viewing our providers as well. So shifting gears just a little bit, there's this idea too, though, of cultural humility and really understanding that various cultures, we are not experts in every culture that comes to our practices, use the technology. And so how can folks be more culturally humble or get the training that they need to really address some of these nuances of working with people from diverse backgrounds?
Yeah, and thank you for bringing this up. It's an important topic, and I certainly don't have the answers to it. But cultural humility training is so important for healthcare professionals, and it definitely needs to be more robust within medical education. Not only medical education, in terms of how we interact with our patients, but also it needs to be incorporated into the treatments and the interventions that we use. Providers, particularly in our case, we use nurse practitioners, they're in a power relationship with clients,
Yes.
making clients even more vulnerable when they seek care with us. So we really need to lower our own sense of self-importance in that relationship and be open to receive other people and their ways of life, which is sometimes even more important in understanding. And in that practitioner-patient relationship, it really needs to be observed, I think, as bidirectional. Each party has something to give, each party has something to receive. And practitioners can't approach that relationship as if they have all of the answers. I think often they don't. And some of their answers just don't apply to segments of the population. Some of those interventions don't apply. They don't land with certain populations. And our own trained and lived experiences are uniquely our own, and they're just a mere thread in the fabric of the human experience. And not everything translates to everyone.
And I think that key is to ask open-ended questions, because I even relate it to when people are going in for maybe nutrition or diabetic counseling, and people are like, well, you shouldn't eat bread, or you shouldn't, you shouldn't eat rice. And there's an assumption in both those communications, right? It's like, instead, it's like, what do you eat on a daily basis, or what do you eat on a weekly basis, so that you can kind of tailor the approach. And I think that's helpful.
Yeah, and it's not easy to change your diet like that when you're living in a household, and particularly, for example, in a multi-generational household where that's the staple food. You're not going to make yourself a specific meal. So how do you still, find a solution within that lens that's doable for your client, where your client can walk away out of that session with you with real tactical tools to implement change and help them in their success and in their journey. And that's often why we find that patients seek mental health providers that look like them, because they're perceived to have a deeper understanding of their unique cultural norms. There's a lot of tools. For example, we talk a lot about boundaries and setting boundaries. And while that's excellent and it's very important, it's often difficult to establish boundaries in a multi-generational household,
Yes.
in ethnic
Yes.
communities, right? And so while we might be saying, well, we want to be change agents and we want to talk to our patients about boundaries, but in that one-to-one interaction, when you're trying to give that patient tangible, tactical tools that they can implement to have incremental success, setting boundaries is too far down the road for them to be able to do. They're going to go home and they're going to screw it up and they're going to get yelled at, and so talking about, I think we do need to establish boundaries in ethnic communities and very much other things. This is just one example, but that's more of a systemic change. And we need to make that change by amplifying our voice as practitioners and providers and mental health professionals in larger forums and educating our elders. But one-on-one, I think in those relationships, we need to provide more relevant guidance, whatever that might be. And you're right, that's predominantly through open-ended questions, and it's through iterating and modifying the standard intervention that's been created based on Western cultures and Western experiences.
Yeah, there's also linguistic limitations. So I will never forget when, after a long day at work, I came home. This is when I lived with my in-laws, and I told my father-in-law, hey, I need a little bit of space. And he's like, what do you want? Do you want us to move out? Do you want to move out? Like, it was just like he really took it like physical space. And that's part of it, right? Is like, hey, I just want to like watch TV a little bit and like maybe not have a conversation, everyone in the bathroom, I'm brushing my teeth.
Yes.
And to him, that was like, oh my God, we need to like physically separate from this entire house, So I think that's just an example of, the family is so close, and it's not necessarily, it could be enmeshment, but it's not necessarily enmeshment, and you're trying to assert a boundary. But that is a very, like for me, I grew up in San Francisco. I was born in San Francisco. So to me, I'm like, well, I just need some space. Like, it's like, no, I just need you out of this bathroom while I'm brushing my teeth. So, I think you're absolutely right in that we need to kind of figure out what is going to actually work in these situations. And I'm big on how-tos. So if you think a little bit about even your experience, and I know this is a very big question, but what are some ways that we can kind of chip away at this multi-generational issue of setting boundaries?
Yeah, that's a really good question. And it's funny that you mentioned too that you lived with your in-laws, because I lived with my in-laws and I had that exact same conversation about space. And my mother-in-law was like, what do you mean? This house is so big. Go find your space. But it's like, I want to be able to come home and just have some downtime and not be, what are we making for dinner? What are we doing here? And this and that. I'm like, just relax, like we'll get to it. Right. So it's interesting that we've had that same experience, but how can we chip away at that change? I think to chip away at it, it's a broader conversation, not a one-to-one conversation with our generation or the next generation that's experiencing these things, but with the parents, with my parents, and with even me. I mean, I think I have some of that intergenerational stuff and some of that old school thinking sometimes too. And so I think it's educating elders and in our generation on these types of topics, so that when they hear them from their kids, they've already been exposed to it. And I think things are changing. I think, for example, I struggled for many years to have children. It took us 7 years, and we didn't have our first child until we had been married 11 years. And back in the day, it seemed like the aunties found it their business to know my business about why aren't you having kids? And that's such a personal question. Why aren't you having kids? Well, that's very loaded. But I do a lot of support groups, and I continue to keep in touch with people, and people reach out to me who are having trouble themselves in our community, because I've been very open about it and very vocal about it. And I do see the changes already, because our generation is acting as change agents. We're being more open. We're sharing our experiences. Back in the day, I think people in my culture particularly wanted to keep things hush hush, like this is a problem. What is the community going to say? What are they going to think? You can't have a kid. Oh my goodness. Or you have an addiction, or you have, a variety of things. They were so concerned about, what are people going to say? What is the community going to think of us? And are we going to be looked at as lower? Right. And I think that has changed. So I'm really optimistic for the future. I think we are changing things, and the next generation is just going to be, they're just going to be so powerful and so independent, and they're really not going to care what others think, and they're going to put themselves first.
Well, one, I'm going to say you are such a strong person, and to go through that situation. And actually, it's funny you say that, because they just interviewed and a coach and an author and so forth that had struggles with and went through IVF, and actually her embryos in the initial round were not viable because the temperature got ruined in the storing facility.
No. Oh.
And so, that led to like a whole holistic health journey. And fortunately, she was able to conceive naturally. She has a son now. And it was really like the intersectionality of stress. And also, I always say, like, I don't think biologically that our bodies have really caught up to women making decisions at a later time in their lives. And I don't want to say all generalities, but because I had kids like before I was 30, but I'm seeing a lot of my patients just they want that choice, that decision of, I'm going to have children at a later time, but our bodies have not caught up to working women making that choice. So this is a good segue to wearing multiple hats. You and I see a lot of similarities, and having two kids, being working boss people. What have you found, if any, to maintain a little bit of your sanity and mental health throughout all those hats that you're wearing?
Yes, well, I'm lucky that I'm just now getting out of the chaos of startup. Lavender is 3.5 years old, and things are becoming a little bit more stable, but it's still very busy. So I don't want to lie; it was very hard for the first 3 years. In 2020 we launched Lavender, and I had my son that year too. So my son was only 3 months old when we launched. And so I had two babies that year essentially. And it was really hard. And I didn't have balance, and I couldn't have balance. So the strategies I'm using now are relatively new. And I say this because I don't want to paint a rosy picture for everyone. There's going to be times and seasons in your life where you have to hunker down and you just have to plow through it, and you have to work hard. You're going to work 16 hours a day, but there's hopefully a light at the end of the tunnel. I'm beginning to get to that light. And the way that I cope with wearing many hats is really time boxing. I am so heavily dependent on my calendar, and I put everything into it. And I actually put all my professional and my personal stuff into my one work calendar. So it's all in there, all my meetings. I'm back to back in meetings, usually Monday through Thursday, but I have all my kids' activities in there. I have my workouts in there. I have my dates with my husband in there. I have everything in there. And the way that I start first, there's an approach in agile development called time boxing. And I've kind of used that in my personal life where I time box. So I put everything in my calendar, and I start with, what do I need to do for myself this week and this month? And I actually book it in. So whether it's workouts, whether it's, getting your roots done or a pedicure or whatever it might be, or a massage, book that in first. Carve out that time for yourself, because if you don't take care of yourself, you can't take care of anyone else. So I'm my first priority, and I've been practicing that this year. Just this year, I started doing that. And then second, I carve out time for the people I love. Right? So what time am I going to be spending with my kids where I'm away from my phone? And that time is usually between 4 and 7 o'clock, where I kind of put my phone away and focus on my kids. And then I, make time for friends and family and my husband. I actually carve out, a biweekly date with my husband, and it's during the day while the nanny is still there. So it's like at 3:30 p.m. to 5:30 p.m. And we have that set. So we know that there's time set aside for us to reconnect and talk about the things that we don't get to talk about. And then only after that is work, right? I mean, that's where you fill in all the other space with work. So that's really worked effectively for me. And I'm so committed to my calendar, and I don't even look at the next day. I tend to look at my day at the beginning, because sometimes it's overwhelming looking at the next day the night before. It takes away and it detracts you from the present moment.
Well, I like that because it's values based, right? It's like self-care, family, friends, loved ones, and then work. And I think a lot of times people are focused, and I'm guilty of it many times, putting that work, putting that work box ahead, and, oh, there's a kid's birthday party. How am I going to switch this around, right? And I'm glad that you said that about the early years, because that's exactly what my book is focusing on, is that my story is not a coming of age story. It is a hot mess. I've embraced the chaos. Mm-hmm. There are aspects of, like, literally, there are many days where I didn't want to take a shower or didn't take a shower because it's like, well, whatever. I'm going to be breastfeeding. I don't care.
Yeah. And that's the one thing too. I'm glad you brought that up, because while I'm committed to my calendar. I still have flex, and I know that every rule is need to be broken. There are days that work is going to spill into your personal, and you're not going to have that time with your kids or your family or for yourself that day. And it is what it is. And it's being able to roll with the punches still, because life is messy and you have to be flexible. You don't want to set yourself up for failure. So it's important to roll with the punches. And it's really about work-life integration. There's balance. Balance doesn't exist, and balance changes from time to time as the seasons of your life change, right? There might be a season where my balance is I am working 12 to 16 hours a day, and that's what I need to do. And I have the support system around me to take care of everything else. And then there's going to be seasons where I'm prioritizing my family because work is at bay right now. So I think that's really important to understand. It's not all, pleasant and self-care all the time.
Yeah. And for me, I have used Passion Planner for years, and this is not an ad. It's legit what I've done. And they have all these aspects of reflection and how to set your goals, and looking at who you want to see this month, what you want to focus on. And I put everything as well in that of, personal, professional. It's really helpful actually to look back year to year. And I write down everything, and it is a little bit more old school, but I always say, you're not in the book. I don't remember. Like, I just can't. There's too much going on. So, but you kind of come a little bit out of the startup phase. What can we expect in the future, or what are you excited about that you're working on?
Lavender is going to continue to grow. We're currently in 5 states. Next year we have big plans, and we're hoping to expand it to 10 states. This year, actually, we didn't expand at all because we grew into our existing markets, but we decidedly said we're going to clean up inside of house, really polish up our processes, make everything run like a well-oiled machine, and be more efficient so that we're ready and prepared to scale and scale with quality in mind. So Lavender will continue to grow. It's been such a blessing and such a reward. And our team is absolutely amazing. We wouldn't be here today if it wasn't for our team, which is almost 100 people strong. So that's super exciting. But this year, one of my goals too was to establish my own platform and my own voice, and really focus on the thought leadership piece of it, because I don't know, maybe it's because I turned 40, but I feel like it's timely, and I really want to give back. And that's one of my life's missions, is to really give back to the community that has given me so much, which is the nursing community and the BIPOC community, and really want to share the lessons that I've learned in the various things that I've done in my career as an entrepreneur and as a leader to help lift up women and empower them to start their own business, whether it be through investing in them, investing my time and energy in them, and supporting, so I will be launching my own website soon, which is pritma.com. And that's really exciting for me. Just, it's not a side hustle or a business or anything. It's really just free resources, trying to support women, because I've been supported by many women and mentors, and it's time for me to give back. So I'm really excited about that.
Your mission is so amazing, and I'm glad that I have already felt that that love and support of coming on the show and really sharing Lavender with our audience. So again, can you remind folks where your new website will launch, but also Lavender and all those things where people can find updates about your work?
Definitely. So Lavender is an online psychiatry and therapy office, and you can learn more about it by going to www.joinlavender.com. We have an amazing, very diverse team of professionals. And then again, my website will be launching soon here in the next week or so, and that's pritma.com, pritma.com.
And all the links will be in the description. So thank you, Pritma, so much for spending your Friday with me. And I know that I would like to continue having you in my life and supporting all of your work.
Thank you so much. And I look forward to your book coming out.
Hot mess coming.
I can relate.
Thanks. In next week's episode, we talk with Grace Young Foster about the Inclusion Initiative, which seeks to provide a space for transracial adoptees and foster care youth. We discuss the pitfalls of adoption and how to develop one's identity in the face of internalized racism. So stay tuned.